Okay, well that's very helpful. So let's move on to postpartum depression. Another thing that affects a lot of women. Can you talk a little bit about that in mainstream gynecology? What the typical treatment is?
So many of you know probably what postpartum depression is, and it typically shows up about within 2 weeks after pregnancy, but there is a little bit extended time frame, and there's certain criteria. But basically, depression is diagnosed through subjective symptoms. I'll come in and I'll be like, I've been down, I don't have any interest in the baby, or, and it may not be the baby, but it may just be your activities. They reflect a lot of the same symptoms as regular depression.
That makes sense.
They also may reflect a lot of the same symptoms a woman may experience with PMS.
So they might just think it's normal or something.
Right, and they may not seek help until it gets bad enough, or may not realize it at all. And it is a recognized thing. Diagnosis. So, if you go to your OBGYN and you let them know what your feelings have been and your moods have been, they more than likely will put you on an antidepressant, like an SSRI, a selective serotonin reuptake inhibitor, which is like your Zoloft and your Prozac and your Effexor. That's the typical treatment. I would say they do help most people, but there are side effects, and I did have postpartum depression.
Okay.
I was put on Prozac. At that time, they had just repackaged it and put a new name on it specifically for postpartum depression. I think it was called Seraphim or something.
Oh, that's crazy.
Yeah. I stayed on it for a while, and I kept switching. In my experience, it was very difficult to get off of the SSRIs.
Really?
Yes, it was very, very difficult. After quite a few years on them, I just wanted to be off, and I had to very, very gradually wean myself. So
I wasn't aware of that side of it.
Yeah, and I've heard about that experience from a lot of other people. I don't know if that's really, I do know that it's always recommended to wean off of them.
So it's something, if you don't need to be on something like that, you really don't want to get started with it.
No. Now, if someone is chronically, majorly depressed without
that's
it,
different.
And they need it, it's different.
Absolutely.
Right.
And that's understandable. There are people that are clinically depressed and need that sort of thing.
Right. But with postpartum depression, what the research has shown is that it can be caused due to a rapid drop in the progesterone. So progesterone is needed to support pregnancy. I think we already mentioned that. Right. And at the end of pregnancy, progesterone levels are very, very high. It gradually climbs out through pregnancy. The sudden withdrawal and drastic drop in levels can cause postpartum depression in susceptible individuals.
Sure.
Obviously, it doesn't.
Not everybody.
Yeah. So, and the statistic for postpartum depression can be as high as 1 in 5. So that's 20%. Gosh,
again, very high.
Yeah, that's that's what the CDC says. So it can be as high. They said in some states it looks like it's as high as 1 in 5. So again, not an uncommon occurrence.
Right.
So if a drop in progesterone is causing this, and of course I didn't know anything about this 15 years ago.
Yeah.
But why would I get on an SSRI when progesterone could potentially fix
a
my
simple
issue? Right.
And
it's a transient issue as well, because my body eventually is going to adapt to the lack of progesterone. But in the meantime, you can there's a postpartum depression protocol that's used by NaPro technology medical consultants, where progesterone is administered. No lab tests are needed. No, it does have to be established that you are experiencing depression.
Sure.
So you would need to see the doctor and let them know what your symptoms are.
Sure.
But the progesterone is usually successful, and there is a protocol. If the first dose doesn't help, then you go to a second dose and a second and a more frequent dose and things like that. Yeah.
You wish you would have known that way back when.
I do. Yeah. I wish. Yeah. I do wish I would have known that.
Again, that's why we do these videos.
Yeah, but now I can speak about my experience.
Exactly.
Too.
Exactly. Yeah. So, and then I imagine you don't have the difficulty getting off of the progesterone once that's
because
finished.
you don't. You only stay on it, and eventually it starts off with injections, and you only stay on it and move to oral if you go through the entire injection protocol and you're still having symptoms.
Okay.
So that you would only stay on. I didn't look at any statistics or data on if you're low to begin with, does it correlate, with you having postpartum depression. If you think logically, it makes sense that you would, but logically that doesn't always show up.
It doesn't matter if
right.
you just need to call your doctor and tell them about your symptoms. It's easy enough for them to recognize it and then get you the help that you need.
Yeah. Yeah.
That's crazy. I still can't believe how simple some of these things are, that we don't even recognize are happening with our own bodies.
Right.
That if we're just, charting and talking to our doctors, that pretty simple tricks that, again, are working cooperative with our bodies, which I think ultimately we all want to be healthier in our lives. Right?
Yeah. And, if you remember, the whole foundation of NaPro technology is let's find what the underlying problem is, and then fix the problem, not just the symptoms, to restore to a state of health.
They call it restorative treatment versus the alternative birth control or surgical treatments elsewhere, which is really kind of taking away or breaking down something. Well, thank you so much. I know I've learned a lot. I'm so grateful for you. Anyway, please share this video and the information with your friends. If you know of anybody who's having these issues, subscribe on YouTube, follow us on Facebook and Instagram, and you can ask any questions at takingbacktheterms@gmail.com. Y'all have a great day.